Hi there. So February is actually Turner Syndrome Awareness Month, which is pretty cool. I thought about finding a neat video or a slideshow or something to give a little information or awareness of what I've gone through or to tell you what I've lived with. And then I thought, well, the heck with that, I'll just make something up myself, so here goes nothing. So just to begin with, Turner Syndrome, it's actually named for Dr. Henry Turner, who first described it and identified it back in 1938. It's a genetic abnormality, basically, that occurs only in females, and it actually happens in about 1 in 2,500 live female births. So it's more common than a lot of genetic conditions, but even then, a lot of people don't know about it. Public and doctors, the knowledge is extremely limited as to what it should be, which is why I think even a little awareness and education is important, just to give that level of support that those who live with it could use, and to avoid having to explain it so much, to have people more aware of it. So about 98% of babies that are conceived with Turner syndrome are actually miscarried. And about 10%, it's estimated, of all miscarriages are due to Turner syndrome. Which, when you think about it, means that it's pretty astonishing and that the odds are against me even being alive right now. So that's a bit of a cool thought. It's also a scary thought because that means if I'm lucky enough to be alive, I've got to be responsible to do something with it. I've got to have more of a purpose. It's just kind of a heavy thought, actually. Most people don't think about being as lucky to have even made it to the earth in the first place. So it's just kind of a cool story. I probably take it for granted or don't think about it as much as I maybe should. But it is what it is, and it's pretty, like I said, astonishing. So causes of TS. It's caused by a missing or a damaged or a malformed X chromosome. You need to know a little bit about genetics in that all human beings have 2 sets of 23 chromosomes or 46 chromosomes altogether in their genetic makeup. And in each cell, and that each cell has 2 sex chromosomes. For females, it's X and X, and for males, it's X and Y. So in Turner syndrome females, one of the X's are either damaged or malformed or are missing. So in varying degrees. So it's an error of cell division, which basically happens when the reproductive cell first begins to divide. It will have lost a chromosome, and then when that cell is used in the makeup of an embryo, then the result is a female with Turner syndrome. It's not known what causes this kind of abnormal cell division, other than it's just a random event. It's not inherited. It's not related to parental or environmental risk factors. It's just a freak of nature or a fluke of nature, however you want to think of it. It can be diagnosed in your utero through prenatal testing. And it's usually only confirmed through a blood test called a karyotype that analyzes all of your chromosomes, and that they will basically look for any genetic malformality that will tell you what's going on. So it's done through a blood test. And signs and symptoms of Turner syndrome, they are manifested so differently in every patient. So no one will have all of the symptoms or features. Some may have barely any, which in my case, I'm lucky to have barely any noticeable signs of it at all, essentially. Outward signs anyway, but most of them are manageable. Just requires proper monitoring, appropriate treatment for whatever comes up. So the issue or the disease is not in the Turner syndrome or the abnormality itself. It's in the effects of the malformality and how it manifests itself. The most common is short stature, with an average adult height of 4'7", I've made it to just shy of 4 feet 10. So there's a lack of a growth spurt during adolescence and overall delayed growth. And outwardly, it's the most noticeable feature of it. But you don't notice someone who's short and automatically say they have Turner syndrome. So it's not obviously identified to this one disease, but it's just the physical effect that most commonly will be seen when you have Turner's. Pretty much guaranteed you'll have delayed growth. The other guarantee is reproductive. So again, the lack of genetic information, it will have delayed or absent onset of puberty, ovarian failure, your reproductive system, and will inevitably be infertility, inability to conceive. Because again, you don't have that genetic information to conceive your reproductive cells, so you're sterile. Other significant effects would be organ-related things such as heart defects, narrowing of the aorta, bicuspid valves, kidney defects, which basically relate to the shape or position, or kidney infections. As far as the heart and kidneys, I've been monitored a lot for heart defects and have so far escaped them. They thought they might have seen a bicuspid valve on one of my echocardiograms, and they continue to monitor it. I continue to see a heart specialist yearly, but so far it's been nothing. They thought they saw it, now they thought they don't see it. But again, nothing significant has resulted from it. And as far as the kidneys, I had a lot of urinary tract infections at one point, but again, that's been manageable, treated, nothing chronic. The other effects are in your bones. They monitor things like bone size and maturity, bone age. One thing they worry about a lot is osteoporosis. And there are other ortho-related effects such as a high palate, narrow jaw, bent elbows that bend out at a higher angle, shortened fingers, just those kind of physical effects. There's also common features such as a low hairline or a webbed neck, none of which I had. Broad chest, puffy or hands or feet, or swollen hands or feet, which is probably one of the features that gave it away, that made them test me for it shortly after birth, and as a result was diagnosed a couple of weeks after birth. So the puffy hands, so they call it lymphedema, is one thing that's often noticed. And narrow or small nails or short fingers. So, I don't know, I still feel like I have short fingers. I still feel like they're somewhat still swollen with or have somewhat excess fluid, but not at all like it was when I was younger. So these effects are typically noticed a lot during childhood. You grow out of them somewhat. Other symptoms are hormonal, things like hypothyroidism, diabetes, high blood pressure, weight gain. I've had weight issues, gained weight, lost weight, starting to gain it again, trying to think about controlling it. High blood pressure and diabetes I'm probably going to continue to have to watch for, especially as I get older. Other things like effects on your skin, the few things that I've actually noticed are the pigmented moles on the skin. There's also physical effects on the ears and eyes, such as low set or rotated ears. I've always thought my ears were weird, but maybe I'm just imagining things. Hearing loss, which I'll probably have to continue to be tested for at some point. Droopy eyelids or other things related to vision. I did have eye surgery at one point when I was really young, related to pupils that kind of turned out at an odd angle. due to a muscle in the back of the eye. May or may not have anything to do with the Turner syndrome. It might. I just don't know. And lastly, related to symptoms, psychosocial symptoms, things that affect like visual and spatial perception, math and geometry, they say or they believe is related to Turner syndrome. I never had issues with math in school or that kind of coordination. Things like attention and memory. Maybe my memory is selective. I don't know. I think that it is, but again, maybe I'm just imagining things. Social anxiety and isolation. I've been somewhat of a loner growing up. Again, may or may not have to do with the Turner syndrome, but if I want a convenient excuse to blame it on, maybe we'll say it is. So yeah, huge variation of symptoms that may or may not be experienced by any one patient. It all varies, which is why care and monitoring is, again, very individualized to the patient and to their needs. But common treatments, usual treatment for Turner syndrome, there is no one cure, obviously, because it is genetic. We can't go back and alter our genetics. It's essentially incurable in itself. What you do is you manage the effects. And again, most of them are manageable. There are treatments. So growing up, monitoring by a pediatric endocrinologist or a specialist, genetic counseling, things like that. We had no endocrine specialist on Prince Edward Island, but I did go to Halifax to the IWK regularly as a child until I grew out of it about 16 or 17. There's still monitoring I can and should get done as an adult. Another usual treatment is growth hormone to increase your final height by a few inches. And that's something that was discussed, thrown around for me. I don't know if it was me or my parents who did not like the idea of poking myself every day. It was kind of discussed and put off a little bit, and then it became later. And the later you leave it, the less of an effect it'll have anyway. And I was kind of on the taller end of the spectrum naturally anyway. Like I said, I made it to almost 4'10", which is good for Turners. So I never ended up going with the growth hormone, but a lot of patients do. The other thing that is always a given for Turner syndrome patients is estrogen replacement therapy, which is your female hormones that'll onset puberty, start your period, allow you to develop those womanly characteristics, if you will. And that's common, that's used. Estrogen also aids in bone growth and preventing osteoporosis. So it's a daily dose, a daily pill. Very much like the birth control pill, it's actually the same hormones that are given. And then the other monitoring or care that takes place is, again, related to your needs. It's hearing tests, things like your bone age, hormone levels, blood pressure, echocardiograms for your heart, all of that just monitors to make sure that none of those issues arise and to have early prevention and treatment, especially of things like heart and kidney problems and other organs. And I mean, like I said, I've been extremely lucky. Most of those things that will happen and what's typical in many Turner's patients who do make it to term and have live births and whatnot is the heart extremely surgeries. And again, I've had none of that. So I've been extremely lucky to have made it without having to deal with any of it. I've basically just had the blood tests, the monitoring, as a patient at the IWK, the hormone therapy, all of that to monitor and treat it, but none of the chronic problems, thank God. And so lastly, in treatment, I guess, is the big one, again, that they all deal with, is infertility. So basically because of my genetics, I would not have the capability to conceive a child without potentially invasive fertility treatment, which would be IVF or donor egg, which I still haven't really decided how I feel about it. The biggest part of me probably does not want to go for creating life artificially, if you will, through that kind of intervention. I'd rather just naturally be able to do what other women are supposed to be able to do, which is to have children naturally. And if I can't, well, that's just nature the way it is in my case, I guess, and that's something that I'll have to accept, and that any partner who I may in the future have to deal with would have to accept as well. And obviously, if I'm truly meant to spend a life with that person, then they'll accept what I've been dealt, because I have to, so they would have to. And again, it's not something, I'm not there yet anyway. I'm not in the stage of my life to have children. I mean, whenever I see friends, family members, peers who every day on Facebook are announcing pregnancies or baby pictures or anything like that, yes, I do get envious. Yes, I think, oh, I'd like to have my own little bundle to hold and take care of and nurture and be a mom. It's that instinct that it's, inbred in a lot of women. And there are some women who would say, well, maybe not everyone is meant to be a mother, but maybe I won't know that until I try one day through adoption or whatever I decide. But I've considered, if that's my journey, it might be adoption, international adoption, giving a child who otherwise may not have a loving home that opportunity. Because, that's what I would want, and I would want to raise a child the way I've been raised, or the way I would think I would have wanted to been raised. I've been lucky. I think my parents did an okay job, and if they could do it, maybe I could do it. I don't know. It's the kind of responsibility. It's hard to think of being completely responsible for another human being and taking care of someone else, and feeling that everything I do is going to have an effect on this child, and just that kind of pressure, and wondering, am I good enough to be given another human being? And if I can, I'm still working and taking care of myself. If I can't take care of myself, how would I ever properly take care of someone else in the way that they deserve? But I think every parent questions that. I think you just have to do it and go with your best instincts. So if one day I adopt and it happens, then it happens. It's not planned one way or another. But anyway, that's kind of somewhat off the topic. That's a whole other discussion, the issue of children and parenthood and life choices. I still want to travel too. I still have a million other things that I want to do in my own life before I think of taking on another life. But it's a lot to think about. The infertility issue is one that every woman with TS probably thinks about the most, or it's probably the hardest to grapple with. But again, it is what it is. If there was one thing that I would question, God on, or if I would say why me on, it would be why can't I do what every other woman, or what most other women, or what women are supposedly able to do, what nature gave us. Why can't I do that? Well, that's what I question. But anyway, and the answers aren't clear now, but maybe one day they will be, and I pray that one day they will be. But at least right now I have plenty of other things to think about with my career and my travels. So it's there, it's on my mind. Turner syndrome as a whole, the infertility issue, just everything I've been dealing with or that I know is there. It's part of my identity. It is who I am. But it's not all of who I am. To be honest, I barely think about it. It doesn't affect my day-to-day life. It's not a physical disability. It's not a mental incapacity. It's not hindering me. It's just something I know that's there, and I know it is part of my body, part of my makeup, but it's somewhat hidden. Like, people don't ask me about it because you don't look at someone like me and say, oh, well, she has a genetic abnormality. What's with her? People don't come up to me and say, oh my gosh, what's wrong with you? People don't come up to me and question it or say, well, hey, how are you doing? I know it must be a tough life. People don't come up to you and say, they just don't question it because they don't see it. And again, a lot of people don't know about it. If I didn't have it, I probably, to be honest, I may not have been educated about it if I didn't have it. And it's not something I naturally talk about or bring up because it's not something, again, that'll affect my communication with people. It's not something that will affect my ability to do jobs, get around, whatever. Which is why, I don't feel the need to give others any background about it. I don't feel the need to answer their questions about it because it's there, but it's not there, in your face kind of there. Which is both a good thing and a thing. Because it's harder to talk about, because it's just complex. There's a lot to explain about it. I feel like if I start to bring it up, then I would then have to feel the need to elaborate and to explain it all, which just seems like a lot of work. But so I'm doing it in one little video. Again, part of Awareness Month. So it's something that should be talked about, or people should at least know about, that even if there are folks out there like me who live a natural life, who have that kind of lifestyle, who don't necessarily look any different except maybe being a little shorter, which could have any number of other explanations. That's just, could be more to people like me. There could be these underlying conditions that people aren't quite so aware about. So it's just that little bit of knowledge kind of helps to break the ice and to know that, there could be these effects that you don't realize, that you don't know everybody's story until you really get into it. And that genetics, people don't often question very much their genetics, other than who do you look like, your mom or your dad, or what color eyes, what color hair, whatever. People think of it as inheritance, features, things like that. Abnormalities in genetics are not something that people often talk about again, unless it's in your face, which in this case it isn't, but again, there's obviously things out there that will affect me, and I guess my form of TS is fairly mild because I haven't had to manifest a lot of the heart problems, the kidney problems, the obvious physical features. I've escaped a lot of those, but there are a lot of girls out there, more than we realize, that are dealing with it, that are having to fight harder than I am to just survive and just to live every day because of it. So that's why it's important to talk about. That's my spiel. Thanks for listening. I know it's been long, so good night. God bless. Talk to you later. Share the love, y'all. Night.